that outlines the specific medical treatments you wish to receive or refuse if you're diagnosed with a terminal illness, are in a persistent vegetative state, suffer irreversible conditions that prevent you from making decisions, or are otherwise unable to communicate your healthcare choices. It typically addresses life-sustaining interventions such as cardiopulmonary resuscitation, CPR, mechanical ventilation, artificial nutrition and hydration, feeding tubes, dialysis, and the use of antibiotics or other medications. It allows you to express your wishes regarding the intensity and extent of medical interventions aimed at prolonging life when there is little to no hope of meaningful recovery. Consider a 75-year-old man deeply valuing his independence and quality of life. He thoughtfully specifies in his living will that if he is diagnosed with a permanent vegetative state as determined by multiple medical professionals, and there is no reasonable expectation of regaining consciousness or meaningful interaction, he explicitly refuses to be kept alive through the use of a ventilator or the provision of artificial nutrition and hydration. He further states his preference for comfort care measures to alleviate any pain or suffering. Why it matters? A living will is more than just a piece of paper. It is an act of profound self-determination and a gift of clarity to your loved ones. Upholding autonomy, it ensures your fundamental right to make decisions about your own body and medical treatment, even when you are unable to do so directly. It allows your deeply held values and beliefs about life, death, and medical intervention to guide critical choices. Relieving family burden. By clearly articulating your wishes, a living will remove the agonizing burden from your family members of having to guess what you would have wanted. This can prevent emotional distress, internal conflicts, and potential disagreements among loved ones during an already difficult time. Guiding clinicians. It provides clear and legally sound guidance to healthcare professionals, enabling them to honor your preferences and avoid providing unwanted or non-beneficial medical interventions. This fosters trust and ensures care aligns with your values. Preventing prolonged suffering. A living can help prevent the prolongation of life in situations where there is no realistic hope of recovery, potentially reducing unnecessary suffering for both the individual and their family. Promoting open dialogue. The process of creating a living will often encourages important conversations with family members and healthcare providers about end-of-life wishes, fostering understanding and shared decision-making. Durable power of attorney for healthcare, POACH/healthcare proxy. A durable power of attorney for healthcare, POACH, also known as a healthcare proxy, is a legal document that allows you to appoint a trusted individual, your healthcare agent or proxy, to make medical decisions on your behalf if you become unable to communicate or make those decisions yourself. Unlike a living will, which specifies particular treatments, a POACH focuses on who will make decisions for you. Your appointed agent is legally obligated to make decisions in accordance with your known wishes and values, or, if your wishes are unknown, based on what they believe to be in your best interest. A 60-year-old woman about to undergo major surgery designates her adult daughter as her healthcare agent through a POACH. If the surgery results in an unforeseen complication, leaving her temporarily unable to communicate, her daughter will have the legal authority to discuss treatment options with the medical team and make informed decisions on her mother's behalf. A durable power of attorney for healthcare provides flexibility and addresses situations not covered by a living will. Your healthcare agent can make a broader range of medical decisions beyond just end-of-life care, including decisions about diagnosis, treatment options, and hospital discharge. A POACH empowers your agent to make decisions in unexpected medical situations that may not have been explicitly addressed in advance. Your chosen agent acts as your advocate, ensuring your values and preferences are understood and respected by the medical team. They can ask questions, seek clarification, and ensure your best interests are the forefront of all decisions. Your agent serves as a central point of communication between the medical team and your family, streamlining information and reducing confusion during stressful times. As medical conditions and treatment options change, your healthcare agent can engage in ongoing discussions with the medical team and make decisions based on the current circumstances and your known wishes. Physician orders for life-sustaining treatment. POLSD/medical orders for scope of treatment, most. A physician orders for life-sustaining treatment, POLSD, sometimes called medical orders for scope of treatment, most, is a medical order signed by both a physician or other authorized healthcare professional and the patient or their legal representative. It translates the patient's preferences for life-sustaining treatment into actionable medical orders that are portable across different healthcare settings, e.g., hospital, nursing home. Unlike living wills and POCs, which are legal documents providing instructions or appointing an agent for future decisions, a POLSD is a medical order for current treatment. It typically addresses a range of life-sustaining treatments, including resuscitation, medical interventions, artificial nutrition and hydration, and other care preferences. An 85-year-old woman with a serious chronic heart condition discusses her wishes with her physician. She clearly states that while she wants aggressive treatment for her current condition, if she were to experience a cardiac arrest, she does not want to be resuscitated, DNR, do not resuscitate. This preference is documented on a POLSD form, signed by both her and her physician. This form is then readily available in her home and will accompany her if she is transferred to a hospital or other care facility, ensuring that emergency medical personnel and other healthcare providers are aware of her specific wishes regarding resuscitation. A POLS provides clear, actionable medical orders for individuals with serious illnesses or frailty. Its portability ensures that your treatment preferences are communicated and respected across different healthcare environments, preventing unwanted interventions during transitions of care. It translates broad preferences into concrete medical orders that healthcare professionals can readily follow, particularly in emergency situations. It addresses the individual's current medical condition and their wishes for treatment at this stage of their life. In an emergency, a readily available POLSD form provides immediate guidance to paramedics and other first responders, ensuring they act in accordance with the individual's wishes. It is the outcome of a detailed conversation between the patient or their representative and their physician, ensuring that medical orders are based on a thorough understanding of the patient's condition and preferences. Creating advanced directives is not just about preparing for the end of life. It's about living with intention and ensuring your values guide your care throughout your healthcare journey. Engage in open conversations. Discuss your wishes and values regarding medical care with your family members and potential healthcare agents. Seek legal guidance. Consult with an attorney specializing in estate planning or elder law to ensure your documents are legally sound and accurately reflect your wishes in accordance with your state's laws. Complete the documents. Take the time to thoughtfully complete your living will or durable power of attorney for healthcare. Discuss with your physician. Talk to your doctor about your advance directives and ensure they are documented in your medical record. If appropriate, discuss whether a POLSD form is right for you. Share your documents. Provide copies of your advance directives to your healthcare agents, family members, and keep the originals in a safe but accessible place. Review and update regularly. Your wishes and circumstances may change over time. It's essential to review and update your advance directives periodically, especially after significant life events or changes in your health. Advance directives are powerful tools that empower individuals to maintain control over their healthcare decisions, even in the face of incapacity. By proactively creating these documents, you not only ensure your wishes are respected, but also provide a profound sense of peace and clarity for your loved ones during challenging times. Embracing the opportunity to articulate your preferences is an act of self-respect and a lasting legacy of thoughtful care and consideration for those you hold dear. Preserving autonomy. A terminal illness can progress to a point where the patient is no longer able to communicate their wishes. Advance directives ensure that their preferences regarding medical treatment are respected, even when they cannot speak for themselves. Guiding medical decisions. Advance directives provide clear guidance to healthcare providers and family members about the patient's wishes. This can help alleviate the burden of decision-making in emotionally charged situations and reduce the likelihood of disagreements or conflicts among loved ones. Avoiding unwanted interventions. Terminally ill patients may have strong feelings about the extent to which they wish to prolong their life. Advance directives allow them to refuse treatments that they consider burdensome, invasive, or futile, ensuring that their end-of-life experience aligns with their values. Promoting comfort and quality of life. By specifying their preferences for pain management, palliative care, and other comfort measures, terminally ill patients can use advance directives to prioritize their quality of life in their remaining time. Easing burden on loved ones. Advance directives can provide significant emotional relief to family members and caregivers. Knowing that they are acting in accordance with the patient's wishes can help them cope with the difficult decisions they may face and reduce feelings of guilt or uncertainty. Practical considerations. Several practical considerations are important in the context of advance directives for terminally ill patients. Communication. Open and honest communication between the patient, their family, and their healthcare providers is crucial. Patients should discuss their wishes and values with their loved ones and ensure that they understand the contents of their advance directives. Documentation. Advance directives should be documented clearly and comprehensively, following the legal requirements of the relevant jurisdiction. Accessibility. Copies of the advance directives should be readily accessible to healthcare providers, family members, and other relevant parties. Patients may consider providing copies to their primary care physician, hospital, and designated healthcare agent. Review and updates. Advance directives should be reviewed periodically and updated as needed to reflect changes in the patient's health status, values, or preferences. It is particularly important to revisit these documents if the patient experiences a significant change in their condition or prognosis. Cultural and religious considerations. Cultural and religious beliefs can significantly influence a person's preferences regarding end-of-life care. It is essential to consider these factors when discussing and documenting advance directives, ensuring that the patient's wishes are respected within their cultural and spiritual framework. Despite their importance, advance directives also present some challenges and limitations. Many people are unaware of the existence or purpose of advance directives, leading to low rates of completion. It can be challenging for individuals to anticipate all the possible medical situations they may face in the future, making it difficult to provide specific instructions for every eventuality. Even with clear documentation, advance directives may require interpretation, particularly in complex or ambiguous situations. This can lead to disagreements or uncertainty among healthcare providers and family members. Procedures for revoking or amending advance directives vary across jurisdictions, and it is important to ensure that any changes are properly documented and communicated. End-of-life care decisions often involve complex ethical and legal considerations, particularly in cases where there are conflicts of interest or disagreements about the patient's wishes. Advance directives are essential tools for terminally ill patients, empowering them to maintain autonomy, dignity, and control over their end-of-life care. By clearly expressing their wishes regarding medical treatment, patients can guide decision-making, avoid unwanted interventions, and ensure that their values and preferences are respected. While challenges and limitations exist, the benefits of advance directives for terminally ill patients and their families are undeniable. As such, it is crucial to promote awareness, encourage open communication, and facilitate the completion and implementation of these important documents. While the concept of advance directives is typically associated with adults, the unique healthcare needs of children, particularly those with serious or life-limiting conditions, necessitate a nuanced discussion of how their wishes and preferences can be considered and respected. Children, by definition, lack the legal capacity to execute formal advance directives like adults. However, they're still persons with developing autonomy and the right to have their views considered in matters that affect them. The challenge lies in how to honor these rights while acknowledging their developmental stage and the ultimate responsibility of their parents or guardians in making healthcare decisions. Several factors complicate advanced care planning for children. Developmental variability. Children's cognitive and emotional development varies significantly with age. A toddler's understanding of illness and death differs vastly from that of an adolescent. Evolving capacity. A child's ability to express their wishes and make informed decisions may change over time, particularly in the context of a chronic or progressive illness. Parental authority. Parents or guardians generally have the legal authority to make healthcare decisions for their children. However, conflicts may arise between parental preferences and the child's expressed desires. Lack of legal framework. Specific legal frameworks for pediatric advance directives are less developed than those for adults, creating uncertainty for healthcare providers and families. Emotional burden. Discussions about end-of-life care for a child can be incredibly emotionally taxing for parents, who may struggle to balance their own grief with the child's needs. While formal advance directives may not be applicable, several practical steps can help ensure that a child's voice is heard in healthcare decisions. Open communication. Facilitate open and honest communication between the child, their parents, and healthcare providers. Use age-appropriate language to explain the child's condition, treatment options, and potential outcomes. Age-appropriate involvement. Involve the child in the decision-making process to the extent that they're developmentally capable. Encourage them to express their feelings, preferences, and concerns. Use creative methods like drawing, play, or storytelling to help younger children communicate. Documenting preferences. Even if not legally binding, document the child's expressed preferences in the medical record. This can provide valuable guidance to parents and healthcare providers, particularly as the child's condition progresses. Healthcare proxy. In some cases, it may be appropriate for parents to designate a healthcare proxy, someone they trust to make decisions on their child's behalf if the parents become incapacitated or unable to communicate. Ethics consultation. When complex ethical dilemmas arise, seek guidance from an ethics consultation service. These experts can help facilitate communication, clarify values, and identify ethically sound solutions. Advanced care planning meetings. For children with chronic or life-limiting illnesses, schedule regular advanced care planning meetings. These meetings provide an opportunity to discuss the child's evolving condition, review goals of care, and address any concerns or questions. Child life specialists. Utilize the expertise of child life specialists. These professionals are trained to help children and families cope with the stress of illness, hospitalization, and medical procedures. They can also assist in communicating the child's wishes and preferences. Specific considerations for adolescents. Adolescents present a unique situation in pediatric advanced care planning. As they approach adulthood, they develop a greater capacity for autonomous decision-making. While they may not be legally authorized to execute advance directives in the same way as adults, their views and preferences should be given significant weight. Mature minors. Some states recognize the mature minor doctrine, which allows adolescents who demonstrate sufficient maturity to make their own healthcare decisions, particularly regarding certain conditions like reproductive health or substance abuse. Emancipated minors. Adolescents who are legally emancipated from their parents generally have the same healthcare decision-making rights as adults. Involving adolescents in decision-making. Even when not legally emancipated or considered mature minors, adolescents should be actively involved in decisions about their care. Their preferences should be carefully considered, and their assent should be sought for any major medical interventions. Transition to adult care. As adolescents with chronic illnesses transition to adult health care, it is essential to ensure that their advanced care planning is revisited and updated to reflect their evolving autonomy and legal rights. Advanced care planning for children, while complex, is a crucial aspect of providing ethical and patient-centered care. Even though children cannot create formal advance directives, their voices and preferences must be heard and respected. By fostering open communication, utilizing a shared decision-making approach, and considering the child's developmental stage, healthcare providers and families can work together to ensure that the child's best interests are served and their dignity is upheld. The legal and ethical landscape surrounding pediatric advanced care planning continues to evolve, and ongoing dialogue and advocacy are essential to ensure that the unique needs of these vulnerable patients are met.